Good morning, everyone. We'll be getting started in just a moment. Just want to allow some time for those to log in. All right. Well, welcome. Good morning, and thank you for attending today's seminar on the impacts of environmental public health hazards on tribal communities. My name is Nicole Dutra-Marquez, Senior Project Coordinator for the National Environmental Health Association, and I will be moderating the seminar today. The agenda for today's seminar includes a quick overview of who is NEHA, where I will provide some insight to our organization and our role in environmental public health. Next, I will introduce our guest speaker, an expert who will speak to you on the impacts of environmental public health hazards on tribal communities. Following the presentation, we will move into our panel discussion with 3 environmental health professionals who will share their stories of working in environmental health with their tribal communities. Lastly, I will share with you information on NEHA's 86th Annual Education Conference. Allow me to cover a few housekeeping items before we get started. Please note that this webinar is being recorded. The webinar recording will be uploaded to the NEHA website at www.neha.org following the presentation. We will take a few questions upon completion of our guest speaker's presentation and during the later panel discussion. Please feel free to drop any questions into the Q&A box during both. At the conclusion of the seminar, you will receive a link to take part in an evaluation where you will be able to provide us feedback and comments for today's seminar. With that, let's begin today's seminar. Before we talk about who we are, I wanted to take a moment to talk about our profession. While many don't recognize it, environmental health is the foundation of public health. As you can see from the World Health Organization, nearly a quarter of deaths are due to a health risk in the environment. Environmental health refers to protecting humans from health risks that come from the environment, such as pollution in the air, contamination of food at a restaurant, or lead in a water source. Environmental health is also one of the 3 legs in disease outbreak. It takes all 3 professions to prevent and reduce outbreaks to protect public health. As an association, everything we do is to build, sustain, and empower environmental health professionals so that they are equipped and prepared to protect the health of communities across the country. Our most recent membership survey revealed that most of our members are working directly with communities at the local level. The survey also illustrated that our members serve all types of communities, from very small to very large. This map illustrates the reach of our fiscal year 2022 projects throughout the country. We supported and partnered with jurisdictions on 768 projects. To support the workforce, we also invest in environmental health via funding from FDA and CDC on topics from food safety to land reuse. In fiscal year 2022, we invested nearly $10 million. Some examples of these investments are support for jurisdictions participating in the NEHA FDA Retail Flexible Funding Model Grant for Food Safety, scholarships for the Leadership Institute, funding for tribal entities and U.S. territories building their environmental health infrastructure, specifically around childhood lead exposure, disaster relief, and vector control issues, and then Health in All Policies mini grants. Part of how we support public health overall and environmental public health specifically is by continuously providing training and education and offering credentials to certify the expertise of our workforce. In addition to our large online library of courses, webinar recordings, and resources, we host an educational conference every year that includes 14 different tracks, from leadership to emergency response to body art to communication. This year, we will be in New Orleans and also on virtual. We have a team of instructional designers who build online and in-person trainings and instructors who deliver courses to provide the latest in research and practice to our workforce. We also provide field training in the Pacific Islands. We offer 6 credentials that certify expertise of all facets of environmental health, as well as specific aspects of food safety practice. We advocate for funding and policy at the federal level for the environmental public health profession specifically, and public health generally. We also provide our members with regular updates on relevant national and state legislation through our webinars and blogs. We believe that part of building and sustaining our workforce is to provide opportunities for professional growth at many levels. We offer scholarships and internships to students studying environmental health sciences, and the first ever Environmental Health Leadership Academy for professionals already working in the field. Much of our work is connecting the right people together and serving as the leader support to set and meet goals that serve the profession and environmental public health. A few of our communities include the Private Water Network, Climate and Health Community, Concurrent Disasters Community of Practice, and the Environmental Health Strike Team Standard Community of Practice. For our members, we provide an online social platform we call Community. It allows members to connect with each other, ask questions, and get tips. On the platform, we offer events like quarterly 30-minute leadership presentations called Spark, and we're launching an Ask the Author pilot for members to ask questions and hear more from a featured author in our Journal of Environmental Health. We welcome anyone who would benefit from the research, education, advocacy, and connection we provide for the environmental public health community. You can learn more about all that we do provided on our website at www.neha.org. Now, let's get to our topic on the impacts of environmental public health hazards on tribal communities. I would like to introduce our guest speaker today, Neil Roy Singer, who has been working as an environmental specialist at Dene College for 6 years. Dene College is part of the Colleges and Universities industry and is located in Sale, Arizona. Dene College is a 2-year community college serving approximately 1,800 students from across Navajo Nation. Mr. Singer is currently the environmental scientist with the National Science Foundation's newly funded Water is Life Center grant at Dene College. He is a graduate of New Mexico State University with a Bachelor of Science in Kinesiology. His focus includes the environmental and health impacts of water quality related to the impacts of microorganisms, uranium, arsenic, and other radionuclides in Navajo Nation communities. His leadership provides opportunities to mentor and supervise undergraduate, full-time, and summer research assistant interns. This work keeps the Dene College team involved with other studies as well, such as the Gold Mine Spill Project led by Dr. Carletta Chief, Navajo Stove Exchange Project with Dr. Lupita Montoya, Helping Mother Earth Heal, Ecological Remedies for Uranium Mill Tailings with Dr. William Joseph Woff, and the solar water filtration units being introduced to the Navajo Nation with Dr. Robert Arnold. Mr. Singer, the floor will be yours in just one moment. Just want to remind everyone to please use the Q&A box at the bottom of your screen to drop any questions you may have for Mr. Singer, and we will address them following his presentation. All right, Mr. Singer, it is all yours.
Good morning, my fellow colleagues and scientists out there in the world, and thank you, Neha, for presenting with us here and coming into my office today. You guys are all invited to my office whenever you want. I'm located in Shiprock, New Mexico, Dene College, North Campus, they call it, out of the GIS lab. My name is Neil Roy Singer, like mentioned earlier. by Nicole is that I am the environmental scientist here at Diné College under the newly funded Water is Life grant with the National Science Foundation. I'm going to go ahead and share my screen, and we'll get started on our little journey here of all the topics that I'll be discussing today. So hopefully everyone can see my screen. I'm a grad student currently right now at Diné College as in the MS program in biology. My focus is on bacterial coliform organisms that might be affecting communities, specifically in a certain northern agency area on the Navajo Nation. The Navajo Nation is one of the largest tribal lands in the United States. Here, you will see that the goal of the Ko'e Na'ed is Water is Life, is a Water is Life Center, is to improve water security on the Navajo Nation and to strengthen the research and education programs of Diné College. As we journey into some of the research projects, as I was introduced to, I would just like to say, to introduce myself in my native language. My name is Neilroy Singer. I just mention that I was born for the Minnehogan people, and my father's clan is the Yucca Fruit clan, and then I was also born for my maternal clans, my grandparents. So I live here in Shiprock, and also known as the Ani Nez in the Diné language. I want to thank you all for joining me here. My goal here today is to let you know that as I graduated from New Mexico State University, I didn't really know what kind of career path I was going to follow, but it kind of just fell in my lap. Diné College actually reached out to me when I graduated and asked if I would teach their biology course, because the person that was in charge was leaving. She had to suddenly leave, so I got approved to teach as an adjunct biology instructor for the first semester. During that semester, I was introduced to the STEM program here, and I got hired on as I applied for the job, and I got hired on as the environmental specialist for the TCUP grant, Tribal Colleges and Universities program. And in that program, we ran a 10-week program during the summer. It was we called it SIP, Summer Internship Program. There, we hit the ball rolling. We already had a grant set up, and what we did was one of the first things my colleagues and I did was to incorporate the Diné College philosophy, which you will see here. It's written in English and in Navajo. We have Season, the assurance on top, and then you go around in a circle to the right. You have Nitzakes, thinking, and then Nhat Ahedot is planning, Ado Inna is living it. So our concept to introduce traditional ecological knowledge into these studies was one of the main focuses that we had. My mentor that I was hired on was one of the greatest scientists that I've ever known on Navajo lands, and he was very much involved in uranium topics. So when we first when he introduced me to the community of Cove, we went through this whole process. Cove, Arizona is a small town about 50 miles from northwest of Shiprock, where I'm located. And it's in the mountains. It's a mountainous area. As you can see in this picture, that background is where Cove is. You can see there's little buildings down there, and this is basically a watershed which was impacted, if you can read these slides, it's impacted by long ago abandoned uranium mines that, there's, as you can read there in the statement of the problem, the watershed project focused about the documented 50 abandoned uranium mines. And so what our job was to go out and I got involved like kind of when all the scientists were already on their way and doing their projects. So how Diné College got our interns involved was just to, sign contracts and teach them, give them the tools in the first 3 weeks of the 10-week program. And then we would assign them to different areas, different research areas. And one of the duties that I had was to take four of our interns, young charges, over to Cove, Arizona, and assist in these areas. One of them was, to the community. It was the main problem in the community was the mine waste that was still remaining in their community. So what I'm going to take you through is just a few posters that we presented while we were in a moment. I will take you through a few posters that we conducted research on in these areas and other topics among the Northern Agency of the Navajo Nation. So our partnering during our discussions, Perry Charlie, my senior scientist, and I ventured out and we started, asking around what's going on with incorporating Western science with the traditional ecological knowledge. And lo and behold, he came back from a seminar one time, and he brought this detail here back, and it was a memorandum from the White House. I got this from the website, that if you want to look into it, there's a memorandum on November 15th, 2021. But when we were discussing it, it was like in the slide before, we already were trying to incorporate, we were already using this technique to approach our science projects, which memorandum, if you read there, it says the memorandum, the Science and Technology Policy and the Council of Environmental Quality, their quote, is elevate indigenous traditional ecological knowledge in all federal science and policy processes. And in these proposals, we would have to observe oral written practices and beliefs that promote environmental sustainability and responsible stewardship of natural resources through relationships between humans and environmental systems. So this is basically what we really incorporated into our proposal to approach our communities that we were trying, to get resolutions from the chapter houses. So we made sure that we incorporated the TEK into the studies, which that gave them reassurance that that Navajo was going to be very involved in their research project. And also, just a few days ago, we were at a symposium, and Brenda Mallory reported also. She gave the speech also that reassured that all traditional ecological knowledge is a part of the decision making across the federal government and betterment of people and the planet. So we found that pretty fascinating, and that's how we approached all of our project. On this slide, it's just an example of one of the projects that we did during the Coal King mine spill in 2015. We took our Diné College students, and one of our summer projects that we were involved in was to, after this mine spill, which impacted 4 states, the accidental spill of heavy metals into the San Juan River. The San Juan River runs right by Shiprock, and it goes all the way, it runs through 3 states to Utah and Arizona, and it ends in Lake Powell. So if you see it, sorry for the small image, but if you can see there the before and after effects of this spill, I remember when this happened, and when I got on board here at Diné College, I didn't know it was going to be right in the middle of this monitoring and collecting samples for this project, which was very fascinating. We learned a lot. We actually got to reach out to the communities and talk with the communities. So this is one project that we were conducting. I'm going to go through these pretty quick because of our time limit. And if you have any questions, my info will be at the end, and I will be happy to discuss more in detail about each and every one of these posters. As we move on, this is the Cove project, same thing. We took a few of our interns out, and we helped the scientists gather and collect samples, and we had to ship some of the samples off. We actually grew some of the plant soil and seeds onto like in a different laboratory to see if there was any uranium, traces of uranium through this process of planting and growing plants on their fields. This was a pretty broad watershed area that we had to cover, and right now it's on a 5-year plan. And when we were involved, it was on a 5-year plan, which was the assessment of the watershed. Now they are doing the cleanup of the watershed, and we are still very much involved in that. There's also a sheep study that we introduced, and this one is the next 5 years. This was just recently. Because of the pandemic, we had to slow down our study here, but we are still finalizing all of our tissue samples and our geospatial locations. As you can see, we partner with different agencies, and this one we have University of New Mexico and Northern Arizona University, and the one before it was the University of Arizona and NAU. So Diné College likes to collaborate with different agencies and to help as much as we can. We invite all other grad students, undergrads, to come and participate in this also. I'm winding down to about 2-3 more minutes here. So real quickly, like I mentioned before, you can reach out to me and I will discuss more of this in detail. This is the community was their idea. These are their questions. Is there any uranium concerns or pathways of exposure through our mutton meat? So we put GPS collars on these sheep and we track them. In the slide in the introduction there, there's a range of all the red spots are where the sheep are or the uranium mines are, and then down in the bottom we'll see where the sheep are grazing. So it's in the watershed. We didn't find any alerts, no high concentrations of uranium in them, and which is a good thing. So I think in next month, we are going to report all this to the Cove community and the chapter houses. And I also have the opportunity to go face to face and talk to them one-on-one, all our volunteers. Finally, this is the project that I'm working on currently with the Water is Life. Water is Life, basically their main goal is set as restoring balance back to the important element of which is water in our Diné language. Monument Valley is it's in a national park, so it's kind of difficult for them to get access to actual infrastructure of water or electricity to their homes. So our community members that we are working with we're introducing to them ways of cleaning up their water before they use for drinking or whatever. But in this project here, we understand that one of the community members is using one of these water sources as drinking. So I believe they cook and they clean household cleaning and stuff like that with it. The problem in this area is that the whole community of Monument Valley is it's spread out, and they're to haul water to their homes. They go to the local store, and sometimes that pump there runs out, which forces this community here from the valley, from the actual park, to go to the next water source, which is located around in this area right here, as the picture in the background shows. So we are trying to introduce this new technology to them, which is the water filtration systems. My goal is to eliminate any of the, if you can see there, the bacteria and the coliforms. There's storage before and after it goes through this water filtration unit. There are larger scale water purifications that are being introduced, but I'm for my project here as a MS, in my MS thesis, my proposal that I'm working on right now will be focusing on the bacterial microorganism regrowth. So with that, there, there's a lot of stuff going on here, people. My colleagues out there, young scientists, there's a lot of work that needs to be done, and we all agree that it should be done out of the tribal university, the young scientists, the undergrads, and the opportunities are here for everyone. There's a lot of issues out there that our elders want us to help and to look into. There's a lot of questions, and young charges like us are the ones that are to take over, because my mentor just retired. He went on to what he wants, his passion, but this was his passion. So I was fortunate enough to meet him, to learn from him, and to share with you all what he's taught me. With that, I leave open a little, maybe a couple of questions real quick before we move on again. Thank you very much.
Thank you so much, Mr. Singer. We will go ahead with any questions that any of you have for Mr. Singer. Please, again, drop your questions in the Q&A box. I know that we have a couple questions already. Mr. Singer, this is from Charlotte. The project sounds very impactful and interesting. Are there any scientists and non-Indigenous involved?
Thank you for that question, Charlotte. Yes, we do. We have US EPA. We are working with the major federal agencies. They are the ones that have to come and listen to our project needs and what we want to discuss, because of there is a uranium commission planning a commission that Perry is a part of, that my mentor was a part of. And he always made sure that we followed federal rules and regulations, especially going out, taking our interns out there. Our safety and our health and safety was first. And we did have all different types of different professionals come to the table planning these science research projects out. So yes, we did have a variety of people there. Next question.
All right, this one is from Jefferson M. Was any of the research on abandoned mines collaborated through an EPA Superfund grant, or was this mainly through academic avenues?
Well, this one here was off of a watershed grant that was awarded to through the National Science Foundation. What happened was we did the US EPA Region 9, the scientists out of San Francisco were the ones conducting this research that allowed us and our students to come in and work with them. So the Superfund aspect of it has just, my understanding, has just recently been noticed, identified, and proposed, and is in the works of being granted as we speak. Soon they they will cover that whole Gate area, not only Cove, but on the other side where there's a whole over 110 abandoned uranium mines out there that they want to focus attention on and to clean up. Right now, the cleanup just consists of two structures that I've seen where they have just capsulized it. They just covered it. People still live near it. The readings are high there, and they are aware of it. They're tearing down a school in Cove that was affected by it. Their water in there was there was high readings in that, and they closed that water, shut that water source down. So a lot of the community still hauls water out there. They do a lot of drinking bottled water, so that's what our final process is now. Is we're finalizing our findings, our results, and we're gonna share it with the community soon. So yes, there should be a Superfund site, but when we were working there, it was not a Superfund site, but it soon will be.
Great. Thank you so much, Mr. Singer. Next, we will move on to our panelists who are here today and who will share their stories of working in environmental health with their tribal communities. Our panelists today are Dr. Shasta Gogan from the Pala Band of Mission Indians in San Diego County, California, Dr. Jamie Donatuto, who works with the Swinomish Indian tribal community located in Washington State, and Frederick Sherman, who works with the Navajo Nation in Arizona and New Mexico. Our panelists will take turns sharing their stories working in environmental health with their tribal communities. As a reminder, if you have any questions for the panelists, please use the Q&A box to drop your questions in. And let's begin with Shasta.
Thank you so much, Nicole, and I'm very happy to be here. I really appreciate Neil Roy's presentation, and it's really heartbreaking to see what is happening on Dene lands and throughout the United States. So this unfortunately is not an isolated kind of an incident. And so for me, the work that I do in Pala, I am not a tribal citizen. I am not indigenous. My ancestors were colonizers of this land, but it's been my job to help protect Pala tribal lands as the environmental director for the last 13 years. And I've worked for Pala also as their tribal historic preservation officer for over 18 years. And in the work that I do, this sort of instance is not uncommon, where we have to really think carefully about the environmental impacts of not just chemical spills and mines that breach, but also just what's in the air and the water and the soils and even in the plants and animals around us. So when I started doing this work, it was not my specialty. I am a cultural anthropologist by training, but this was what the tribe needed from me. And so it's the work that I do. And I have a lot of other projects that I'm involved in the climate change space, but I'm not going to go into that right now because it could take the next 27 minutes and that's all we have. So I'm going to let our other panelists introduce themselves first.
All right, thank you so much, Shasta, for sharing your story. Jamie, please go ahead and share your story.
Thank you. Good morning, everyone. Thank you for inviting me to speak today. And thank you for Neil Roy for sharing all of the important work that's going on the Navajo Reservation with Dene College. My name is Jamie Donatuto, and I'm speaking to you from the indigenous homelands of the Swinomish, the Suquamish, the Tulalip, and the Lummi peoples. So we're in Northwest Washington State in the Salish Sea. I've been the environmental health specialist for the Swinomish Indian tribal community for the last 23 years. And I just want to share with you a story about how I started with this work here to give you a better idea of what sort of opportunities are out there and also what it's like to work for an indigenous community. As Shasta mentioned, I also myself am not indigenous. I am of Italian and Jewish descent, and I started working for the tribe right out of my undergraduate degree in my early 20s, and so have spent a lot of my adult years there. And you learn a lot. It's a very different worldview. So when I first started working for the tribe, I was hired to look at, I had a toxicological background, and I was looking at bioaccumulative toxics in local traditional seafoods. So seafoods are very important to Swinomish, their fishing community. We were looking at salmon, crabs, and clams. And for any of you who are toxicologists, you know that the basic equation is your dose times your toxicity is your risk. So your cancer, your non-cancer outcome. And so we played with that model a little bit, changed it for instance, the amount of fish that people were eating, which was much more at Swinomish than for the average American, thinking about exposure duration. The average American they assume an average American lives in one place and then moves. For many people who are Indigenous, you live in the same place for your entire life. And so we changed the exposure duration to be much longer. And I presented all of this information to the governing body of the tribe, which is called the Swinomish Senate. And there was this super awkward silence. And I thought, oh, I've really messed up here. This is my first year on the job back in 2001. And then the chairman looked at me and he said, this is not how we define health. This is a very Western way of thinking about health. It's not just a physiological impact. We think about health as very interconnected. We have human relatives. We also have other relatives that aren't human, like the animals and the plants. And you also need to think about connections with the water and the air and the land, where we've been since time immemorial. And that with the spiritual world is how we think about health. And so you need to go back to the drawing board and figure out what sorts of toxics are there, but also how that impacts our definition of health. And that led me on the career that I'm still on today. And as Shasta mentioned, when you work for a tribe, you do lots of different projects. So we continue to think about what Indigenous health is for Swinomish, and also work with other tribes about defining their Indigenous health indicators in the context of development projects, climate change impacts, cleaning up contaminated areas. There are so many ways you can use it. As well as we build gardens, we teach classes with youth. I mean, there are so many different things. We have climate adaptation projects. The work goes in many different ways. But in order to work for a tribe successfully, I think it's important to understand it's a different way of life. It's a different knowing. And you have to be open to learning that. And it's an incredible experience. So thanks for letting me share my story. And for those of you looking to start a career, I hope this is helpful.
Thank you very much, Jamie, for sharing your experiences. And Sherman, please share with us your story.
Hello, good morning. Can you hear me?
Yes, we can.
Okay. My name is Frederick Sherman. I'm coming to you from Navajo Nation. I am a member of Navajo Nation, an enrolled tribal member. My clans are, I am born for the Whitecorn. I am of the Whitecorn Zuni Edgewater people, born for the Bitterwater, and my maternal grandparents are the Minigoats Red House clan, and my paternal grandparents are the Reed clan, and that's how we formally address each other. And there's kinship out there. We do have relatives. So hi to those that might be my relative. I've worked, what I bring to the table is regulatory, environmental regulatory development. So we develop regulations, everything from industry to the home front, to grandpa and grandma, outreaching to them and educating them about the importance of proper disposal of solid waste. I work with the Resource Conservation and Recovery Program. Basically, we're mirroring the federal RCRA laws as far as the non-hazardous waste goes, and work one-on-one with US EPA Region 9. And for me, I think that very impactful work that I do is translating some of these tough terminologies that are often abstract and it's also intangible. How do you communicate those? How do you communicate it to an elder who doesn't speak English? So oftentimes I draw from ceremonial knowledge, religious knowledge, creation story words, because oftentimes those terminologies are in the spiritual setting. And I draw from those and then create the dialogue with them. And I think the greatest impact is to see on the face of an elder an epiphany. At that moment, they understand what you're saying. And then they come back to you and they say, thank you for doing this. Now I totally understand why we're doing this, or why the regulations are in place, or why I should not burn like plastics or styrofoam in the wood stove that heats my home. And up to this point, I was confused, and people don't adequately translate terminologies and concepts. So those are, in those moments, I feel like I didn't, I brought education to the doorstep of a grandma who doesn't speak now English. And when you do that, you can just see the rewards. You can see that there's some level of understanding. So that's the type of work I do here on Navajo. I've done work in the formal teaching setting as well. Back then it was Crown Point Institute of Technology. Now it's Navajo Technical University. Did the introductory 100, 200 level courses in environmental sciences. And my biggest impact there was the ability of integrating Navajo environmental knowledge into the textbooks, into the environmental textbooks, into environmental science textbooks, and going into the Navajo creation story, Mother Earth, why do we call her Mother Earth? And then Father Sky, why is it called Father Sky? And then at the juncture of both, where the Father Sky and Mother Earth interact, we're the product of that. So recreating that, using Navajo terminologies that are drawing from our creation story and how the world was made, how the world was formed, and how we have plants as our relative, animals as our relative, and then how Mother Earth, her body is similar to our body. So using all of these parallelisms and concepts and drawing that and weaving that into the textbook. So I felt like by the time I was done with the cohort, they had a better understanding of not only the environmental science, but also where the Navajo people come from, and the meaning of our ceremonies, the meaning of the healing ceremonies, and the artwork that we have that represent, and through the art, it stores the information of our existence in the world that we understand around us here on Navajo Nation. So working with the Navajo public to do preventive work, and then changing the mindset of our Navajo people, doing a paradigm shift and having them understand that they are empowered to make the correct choices to improve their, to reduce their risk exposure to environmental hazards from a Navajo perspective, using Navajo language and taking the knowledge from the scientific community and integrating it so that they can relate to it. That's the type of work I do, in addition to the regular environmental regulatory enforcement work.
Hey, thank you so much, Sherman. That was much appreciated information. You definitely touched on why tribal representation is essential in environmental health. And I wanted to pose a question to Jamie or Shasta on your thoughts on why representation is essential for tribal environmental health.
Well, I could tell a story as well to encompass why that's important for not just Paula, but the tribes throughout Southern California. We are in the midst of working with one of our regional water boards to develop what are called tribal beneficial uses for waterways. And without the representation of tribal citizens, and in San Diego County, we have Cupeño people and Luiseno people, and that's who lives in Paula, Kupangawachum and Payonkawichum, also Kumeyaay and Cahuilla. And then in Southern California, we go beyond that. There's also Serrano, there's the Tongva and there's Chumash. And so, a lot of different tribes with different uses of the land, different cultural values, although there's more similarity than not. And if we didn't have that ability to represent the tribal values and needs when it comes to the uses of water, or those things that are affected by water, for example, the gathering of plants that might be used for traditional crafts, such as basket weaving, or the harvesting of plants or animals that might be part of ritual or ceremony, people don't think about the uses of water in those traditional ways. The water board tends to focus on, is somebody going to be fishing for recreational use? So is the fish healthy to eat for your average fisherman? But they're not thinking about the way that tribal folks might be harvesting those fish, which may be actually in the water, with nets and baskets. And so what is the exposure impact of that kind of use? And it often takes place in the areas that aren't generally thought of as where you would fish, which in very dry Southern California is reservoirs and things like that. There are natural places where those activities can take place. So if we don't have tribal representation as part of that process in developing the water quality standards, that's really what it's all about, is what are the water quality standards, then those tribal beneficial uses are not going to be considered. And it may be that the water bodies that people are coming into contact with, ingesting, getting on their bodies, especially our children and our elders, that's going to be really damaging to them if they can only go to those places that the water board thinks are the places people come into direct contact with the water. So that's a place where for us, representation is really, really important. And that's just one example. I think it's important in every aspect of environmental health.
Yes, thank you so much, Shasta. That was wonderful. Jamie, do you have something to add to that?
I think the examples that both Shasta and Frederick have given are fantastic. And I think the only thing that I have to add is more on an individual level, which is that my ultimate goal has always been to replace myself with a community member who wants to do this job. And that ultimately is what tribal representation is community members being able to represent their own communities. And, speaking for Swinomish and other tribes in Washington state, setting precedents after precedents of protecting the health and welfare of not just Indigenous people, but of all people in Washington state. So I think tribal representation actually is not only powerful and important for tribes, but for everyone.
Well made point. Thank you so much. Let's see. And as a reminder, all attendees, if you have any questions for our panelists, please drop them into the Q&A box and we can get to those. Let's see. Sherman, what do you foresee as future goals pertaining to environmental public health for the Navajo?
Really, it's a paradigm shift. We're in a new world, a world that's changed from the last 100 years. Our ecological footprint of a Navajo individual has changed. We're more in tune with being affluent there's a need for electronic devices and flat screen TV, computers, laptops. So our waste stream has changed, and we really need to look at our ecological footprint and reassess that, and to really go forward to a zero waste and to revisit our waste, how it used to be biodegradable. Probably the only product of the waste pile used to be corn cobs, broken pieces of pottery, and animal bones that were cooked from the home in the household. Otherwise, everything else was biodegradable. So in that sense, some of us on Navajo are still disposing of our garbage as if it was still biodegradable. So changing those mindsets and being out there, boots on the ground, communicating with the elders and the citizens of Navajo, and changing that set to become more of a zero waste and to move toward reducing our footprint and going back to our low impact on Mother Earth and our low impact on Father Sky, as far as like air pollution and burning garbage, and then as far as protecting the waterways on Navajo. So long-term solutions would be to be more reducing our waste, zero waste, and going toward a reduced ecological footprint. And I believe on Navajo, there's a greater understanding and a direct result of community engagement and community buy-in that I see is voluntary compliance and people making the better decisions about how they shop, how they buy more bulk, and how they're driving the distance to correctly dispose or recycle the waste that they generate in the home. And this definitely has an impact on our waterways and also has an impact on our indoor air quality, because some people use the waste they generate as a fuel for a heating source, like burning styrofoam and plastics in the home wood stove. And just been out there educating them that those aren't the best ways to heat the home.
Great, thank you so much, Sherman. I definitely agree with you that there's a ecological footprint impacting many populations across the nation. We have a question for Jamie. Given the tribe's holistic view of health, how have you addressed the impacts of chemical contaminants in the environment beyond the usual risk estimates generated by risk assessments?
Thank you for asking the question. I'm going to drop into the question box just a paper that gives you an example. And I don't know if everyone can see what I just dropped into the question and answer box or not, the link, but what we've done is we've developed a set of Indigenous health indicators. So very briefly, what they are indicators that assess non-physical aspects of health, which are essentially intangible, right? Like you can't put a number to the importance of a ceremony using something that may potentially be contaminated and how that impacts both an individual and a community. So the way that we have gone about doing it is thinking about constructed metrics. And I won't get too much into the weeds here about methodology, but essentially thinking about the APGAR scale when babies are born, thinking about Likert scales, thinking about like stoplights. These are all constructed scales of basically very good to very bad. You can use narrative scales like that as well. And then we work with the community really closely, and got all the work is guided by elders to essentially ask, in this particular context, where are these different non-physiological aspects of health? How are they being impacted? And you can use those kinds of scales to determine And that is how we essentially evaluate what the impacts are. And from there, then the tribe can move forward in deciding how they want to address it. So I hope that's a very short answer. You're welcome to contact me. I'm happy to have longer discussions about this. Thanks.
Great, thank you, Jamie. We have another question from Charlotte. What advice would you give to someone who wants to be involved with tribal public health?
Well, I'm going to jump in there just by pointing out again that I am not a public health specialist. I don't know how this happened to me. Like I said before, my training is in cultural anthropology, but I came to Paula and did my dissertation research there on the tribe's casino and the impact it was having on the economy, politics, identity, political relationships. And when I got there, they said, "Do you want a job?" And I said, "Okay." What graduate student's going to say no to a job, even if it's not what you plan to be doing? And I have never left, because what the tribe needs is what I will do. And so you don't have to necessarily be an expert in public health to end up getting involved in tribal public health. But like Jamie said, my ideal is that this role would be held by a tribal citizen. If not from Paula, then at least from one of the local tribes. So what I would say is, if you are not Indigenous, but you want to be a part of this work, is to forget everything that you think you know from the Western science side of things, and be willing to be humbled by the knowledge that the community has to give you. And that doesn't mean that what you've learned in school isn't relevant or important, especially when you're dealing with agencies and regulations. And I see Frederick nodding and like, yes, you know exactly what I'm talking about. And I think we've probably met because we're both in Region 9 and doing similar work. But just be open to the option of working for a tribe, but be also open to not assuming you can't assume that you know more than the people that you're working with, because they know more than you do. And you have your expertise on that Western side, but you know nothing about how that is actually going to apply to the people that you are working with. So, and I see what Jamie put in the chat, be a good listener. And I'm going to second that, and take the advice by being quiet and listening now.
Great. Thank you so much. Thank you to all of our panelists today, Shasta, Jamie, and Frederick. Thank you so much for sharing your stories and sharing such great insight for our attendees today. This year, NEHA is hosting our 86th Annual Educational Conference in New Orleans, Louisiana, July 31st through August 3rd. The theme is Raise the Voice of Your Environmental Health Workforce. Early bird registration is still open. The AEC provides a unique opportunity to network with hundreds of environmental health professionals and those just beginning their careers in environmental health. You can get more details on how to register at www.neha.org/AEC. Let me share with you that our AEC keynote speakers will include Maureen Lickfield and retired Lieutenant General Russell Honore at the conference. And I would like to thank our speaker, Neil Roy Singer, and our panelists again, Dr. Shasta Gogan, Dr. Jamie Donatuto, and Frederick Sherman for partnering with NEHA and providing great content to all of our attendees today. And thank you all for attending today's seminar on the impacts of environmental public health hazards on tribal communities. Please complete the evaluation for today's seminar. We would greatly appreciate your feedback, comments, and recommendations. And please feel free to contact us anytime by visiting our website or by contacting us by phone or email. We will drop those into the chat box for you. And thank you again. We hope you all enjoy the rest of your day.
Thank you.
Thank
Thank
you.
you.
Thanks. Bye-bye.
Bye. Thank you.